We're back with the Problem Solvers Health Alert. June is National Men's Health Month, and a recent study found 2/3 of men, 2 out of 3, think that they are naturally healthier than other people. The reality is they're not. Most likely, they're not. So joining me now to talk about the things men need to keep in mind this month and really every month, Dr. Kerry Thurman over at Denver Health. Dr. Thurman, thanks so much for being here. I appreciate it.
Thank you.
I know men don't like to talk about all of these things, but it's really important to bring them up. I've been having many conversations with my father about this, prostate cancer. How often do men get it? When do they need to get checked? And what is getting checked like?
Yeah, so prostate cancer is one of the most common cancers in men. We use a blood test called prostatic specific antigen to screen. PSA,
Yep.
Exactly. And we recommend starting at age 55 to get screened yearly. If you have risk factors, meaning a family member, brother, or father had prostate cancer, or you're African American, we recommend starting screening at age 40.
Okay, good information there. Moving on to LUT, lower urinary tract symptoms. What are the common ones? What do you guys need to know about this?
Yeah, so lower urinary tract symptoms are extremely common. Typically, it's due to benign prostatic hyperplasia. So again, that prostate getting in the way.
Okay.
Common symptoms are weak urinary stream, urinary urgency frequency, getting up at night to urinate, and incomplete bladder emptying.
Is this a symptom that older men have or younger men as well?
Yeah, so men can start having these symptoms as early as age 50. So about a quarter of 50-year-olds start having these symptoms, and it only increases as you age. So by the time you're 70, you have a 70% chance of having these symptoms.
Okay, good important information to keep in mind. Testicular cancer, I think this is one that I've seen, and unfortunately, with younger men too. So what do guys need to do for this? And at what age should they start being concerned about just the idea of it?
Yeah, so as early as men start showering on their own as teenagers, they can do self-exams. This can be done in the shower or bath, and we recommend monthly and at your yearly appointment with your doctor. And it's just an easy self-exam to look for nodules or hard lumps.
And this can happen in guys in their 20s, basically, unfortunately.
Absolutely. Yes.
Okay, and really quickly, I think I saw a stat when you talk about erectile dysfunction. Doctors say it needs to be normalized, and there are, what, 30 million men in America who kind of struggle with this?
Yes, erectile dysfunction is extremely common. It's due to a lot of lifestyle factors. We eat a lot of sugary, fatty foods. We start having coronary artery disease earlier, and that can affect the blood flow to the penis. And so we really want to talk about this with men, and we want their quality of life to be wonderful.
Is that something a man can talk with his primary care doctor about, or needs to go see a specialist like a urologist, such as yourself?
Yeah, he can absolutely talk to his primary care about this. There are lifestyle modifications, sex therapy, medications such as Viagra or Cialis, and then also there's surgeries.
Okay. All right. Dr. Kerry Thurman over at Denver Health. I know we rushed through this, but very important information. I appreciate it.
Thank you.